So I'm Ann Avery, and I am the director of the Clinical Hematopathology Laboratory here at Colorado State University.
My name is Adam Harris. I work in the Department of Microbiology here at Colorado State University.
My name is Emily Root, and I am a clinical pathologist here at Colorado State University.
Because I'm also a veterinarian, I would go to things like the clinical pathology rounds, and one of the dilemmas that kept coming up in their discussion of cases was, is this collection of lymphocytes neoplastic or a tumor, or is it just that this dog is having a response to an infection? And that distinction is sometimes hard to make. And so we shifted our attention to cancer of lymphocytes as opposed to lymphocyte function in infectious disease.
In our lab, we study a lot of different forms of lymphoma and leukemia, and some of those forms are also seen in people. One of the projects I've worked on is studying a disease called B-cell chronic lymphocytic leukemia in dogs. And historically, we've thought that it's a pretty indolent disease, meaning that dogs often do quite well and have prolonged survival. But we've found that actually a subset of dogs with that disease can have a more aggressive clinical course. And we're hoping if we can figure out the differences in the tumor biology, we might be able to investigate more effective treatments for those cases that do behave more aggressively.
I personally find it fascinating that dogs have these very breed-specific predilections for different kinds of cancer, right? Golden retrievers get T-cell lymphoma. Boxers get this much more aggressive kind of T-cell lymphoma. I think that's a place where dogs can offer something that you can't get as much from human research. Because of these breed-specific problems, it gives us a way to look at the genetics of these diseases. Got it.
My role here is investigating canine acute leukemia and seeing how it compares to human acute leukemia. And acute leukemia in dogs has a really poor survival time of only a few days to a few weeks. And so dogs really need a therapeutic option. There are a few genes that are shared between canine acute leukemia and human acute leukemia. We're really excited about the preliminary findings and hope to really chase these down and see if there are specific targets for therapeutics.
I think basic science is important to cancer research because it allows us to learn more about the underlying tumor biology. And the more we learn about the processes that are driving that tumor, I think the better chance that we can develop targeted therapies so that we can improve treatment of these diseases.
What I'm hoping that we will continue to do is, on the diagnostic side, use a lot of the contemporary methods that are now available because we have good resources, the canine genome, lots of information about cancer in people that we can apply to dogs and vice versa.
I hope that years from now we can see that we're more effectively treating a lot of these really common tumors in dogs and cats and getting better results.
I'm most excited about the translatable aspect of it. I really think that both veterinary and human medicine could benefit from us understanding cancer in another species and comparing that to what we know currently with human cancers.